Welcome, everybody, to our 24th live episode of Ask Dr. Smith. Put together a pretty incredible program for you. Acute and chronic pain is unfortunately part of pretty much everyone's life. You live long enough on this planet, you're going to have acute and chronic pain from some source. The information I'm going to be sharing with you is very powerful. You're not going to hear about it on the 11 o'clock news, and most healthcare practitioners are unaware of some of these issues because they're kind of esoteric. And after 51 plus years of clinical practice, when you keep flipping rocks, you find some real interesting answers. So I have a special guest coming on around 8:30, Stanley Ngui. We're going to extend it probably a half hour. I think it'll be to your benefit because he's a 23rd generation master, Qigong master. That's incredible information on energy. So anyway, we're going to start the slide presentation, and it'll be up on our ghsdoc.live probably tomorrow, and we'll take it from there. So basically, acute and chronic pain affects pretty much everybody. But the key is that with all these pain management clinics, they're just treating symptoms and they're not looking for underlying core issues. So you have to define the core components to solve the problem. I wrote a book many years ago called Alternative Treatments for Conquering Chronic Pain. And it's one of the few books that are out there that integrate osteopathic, chiropractic, physical therapy, nutrition, dental concepts, medical concepts. And this is reality, people, not the fluff that you see in traditional medicine and dentistry. Book deals with migraines, tension headaches, arthritic pain, atypical facial pain, head, neck, shoulder pain, low back pain, eczema, trigger points, just a whole plethora of topics. So it's available through icnr.com or GHSdoc. It's worth reading. I put my heart and soul into these books that I put out. The other one that's really beneficial is Remove the Splinters and Watch the Body Heal. It uses the KISS principle, keep it simplistically simple. And the closer one gets to the truth, the more simplistic the solution is. So it's a game changer because it really shows you what the potential underlying causes for chronic pain and cancer and all kinds of interesting medical maladies. So it's available in a download form and also in a printed form for those that like to hold something in their hands and read. Amazingly, 70 to 90% of all medical problems have a dental origin, and especially when it comes to pain. So the dental factors provide a major influence in the rise of degenerative diseases, structural problems, chronic illness, and cancer. And once you see some of the components that I'll be presenting, you'll understand very clearly why the dental component is a major, major issue with chronic pain. So when you just look at the teeth, they're directly connected to your brain. I mean, this diagram says it all. I really don't have to say too much after this slide, but the nerves from your teeth are directly connected to the brain, and each tooth also represents a connection to organs and vertebrae in your spine. And unfortunately, dentists do not understand the structural component of the bite, how it affects your cervical and spine, your sacrum, your pelvis, your knees, your feet. And, they just think that you're working on a mannequin. But you can have one minor interference on a tooth causing low back pain. And again, 99.99% of the dentists have no clue about this concept. So this direct connection between the teeth and the brain, in fact, in the when the heck was it? In the 1930s, I think in Switzerland, they did a study where they took dogs and they put mercury fillings in, and unfortunately sacrificed them. But in 24 hours, the mercury was in the brainstem. In 48 hours, it was in the pituitary gland of the brain. So if a dentist puts a toxic dental material into your tooth, that likelihood of being up in your brain is going to be very, very high. So that's why it's so important that you deal with a dentist that knows what the heck he's doing and is using biocompatible materials and the least toxic if possible. You can see go on the website, you'll see charts of the teeth and the relationship to the different vertebrae and the different organs of the body. It's pretty interesting. In the acute stage, it follows probably in the high 90% that there's a direct correlation, especially women with breast cancer. You'll find the upper first and second molars are related to the breast cancer. So you'll see the direct connection. And like I said, most dentists don't have a clue about this component. 11 questions to answer when treating pain. Very important that you focus in on the issues. So here are the questions. Okay, is it a structural problem? In other words, is there a cranial distortion, a subluxation of your joint area? There are psychological issues, chemical issues. You have to ask the right questions in order to get to the core of the reason for the pain. Is it a pathological problem? In other words, is there herpes zoster, which is a virus, herpes simplex, strep, Lyme, or babesia, rickettsia, other different infections? Is it a vaccine problem? You can have trapped vaccines in different tissues of the body causing pain, and the adjuvants are so damn toxic. The formaldehyde, the polysorbate 80, aluminum, thimerosal, which is ethyl mercury. There's antibiotics. There's all kinds of chemical poisons that are adjuvants to increase the antibody reaction of the body. Is it a drug problem? I've had patients that had specific drugs trapped in different organs of the body, prescription drugs. And, most doctors think, oh, this stuff's metabolized and it passes out of your body. That's farthest thing from the truth. But again, it's not in their vocabulary and they have no clue about, what questions to ask. So is it a reflex problem? So you can have a shoulder pain coming from a spastic teres minor muscle in your shoulder, which is reactive because of an underactive thyroid. But again, the doctors see pain right away. They're talking surgery, injections of steroids, but they don't understand functional anatomy and they'll never get to the root cause of the problem. Is it a cavitational problem? Cavitation problems are basically residual infections in the jawbone, and they can refer pain to anywhere in the body. So it's something that most dentists and unfortunately most of the medical doctors will not even consider when analyzing your pain problem. Is there a scar problem? So scars trap sympathetic nerve fibers during the healing process, causing constant firing into the nervous system. Years ago, I had a woman that had a C-section, and she was in chronic pain from it. And after I injected it with Procaine, the next day, the 95% of the pain was totally gone. So there's many different modalities to treat it. You can use a laser on the scars, injecting Procaine without any preservatives. It's called neural therapy. So is there a virus in the tooth? Example, the pulps of the teeth, they have an active blood supply. So if the virus is floating in the blood, why can't it get trapped in the tooth? But again, in dental school, I was never taught these concepts. Is it a nutritional problem? You can have a deficiency of B complex vitamin causing muscle spasms or headaches. And again, most doctors, they get about 3 hours of nutrition in medical school, and they think synthetic vitamins are no different than food-based organic vitamins. Is there a galvanic problem? Meaning you can have two dissimilar metals in the mouth causing an electric current, and that could be causing pain in the tooth or in the gum. It's a battery. I mean, if you go into a high school class and ask in the chemistry class, what do you have if you have two different metals in the mouth and the conductor? Oh, we got a battery. Well, same thing can occur in the mouth. Are there tattoos or piercings? Believe it or not, these are hidden potential areas. In fact, in the tattoos, the color that they use are actually acrylic, and they can stimulate sympathetic activity, causing pain. Silver rings have nickel, which can migrate to different areas of the body, causing pain, eczema, all kinds of rashes and problems like that. So you have to ask the right questions when you're dealing with a chronic pain issue. So this physiologic adaptive range, it's one of the most comprehensive and integrated paradigms in existence for treating the whole patient. And when you have a chronic pain patient or even acute pain patient, you have to look at the whole enchilada. You just can't, treat the symptom, because if you don't get to the underlying core issue, you're not going to solve the problem. And in 1982, I wrote an article called The Physiologic Adaptive Range, and it deals with the cranial complex, the dental complex, the pelvic complex, the physiological complex, and the psychological complex. And invariably, patients' problems fall in one or any combination of these 5 categories. So, there's many forms of herpes zoster, and herpes zoster can be extremely, extremely painful. So, for example, we had a woman who had a chief complaint of 10 years of severe pain in her mouth. Been to all kinds of specialists, nobody could figure it out. Well, wound up, she had shingles in her mouth. And to be honest with you, before that incident, I never, heard of such a thing, and certainly never learned that in professional school. And she was so debilitated, I had to put her on a nutritional program for a month before we could start to eradicate the actual herpes zoster. So these are type of things that traditional doctors will never factor into their diagnostic. And here's a pretty interesting case of a chiropractor who came to me after suffering pain for a year, running around to all kinds of specialists, and she had pain in her mouth. And the interesting thing is, when I diagnosed her, she had shingles in her mouth in the third molar extraction site. So I just want to listen to this.
I'm a chiropractor. I've had pain in my sinuses, my up in my nose, into my eye, my left eye, and into my ear for about a year after a wisdom tooth was extracted. I was trying to find the right place to go. I've had a lot of bad experiences with dentists in the past. I found Dr. Gerald Smith through the Price Pottinger Foundation. I've came in a lot of pain, crying, and he's diagnosed me with shingles. After we just finished the treatment, and I'm 80% better already. I'm very grateful for that.
So the amazing thing about this whole scenario was when I made the diagnosis of shingles in the third molar extraction site, she said, geez, 2 months before I had the tooth extracted, I had shingles on my back. And what I found clinically is that viruses migrate to areas of trauma. So if you had a fall or contusion or surgery, these viruses literally migrate to these areas of trauma. And this poor woman suffered for a little over a year, running around to all kinds of specialists, and nobody had the foggiest idea what was going on. Here's another case of chronic shingles. Back in 2017, Patrick was diagnosed with herpes zoster, and they were putting him on his valcyclovir. Again, they're treating the darn symptoms without looking at the underlying cause. And the poor guy had chronic pain and 7 bouts of shingles outbreak. And it's really disgusting that these things happen. So basically, he had a thyroid problem, and he had contamination with elementary mercury. He had cytomegalovirus, glyphosate, which is Roundup, and the tetanus vaccine trapped in his thyroid. His upper left central incisor was contaminated with cytomegalovirus, which is also present in his jawbone, where he had a lower left wisdom tooth extracted. So the 2 areas served basically as a toxic waste dump from which the lymphatic system of the mouth drained its waste products into the thyroid. So it's interesting that none of his physicians ever picked up on these critical issues. Excuse me. Patrick was placed on a nutritional program plus biofrequencies to destroy the herpes virus, and as well as the cytomegalovirus. And the results were no less than spectacular. He's totally pain-free and didn't have any recurrences. So these areas are never going to be covered in your blood test, or going to be able to locate it in a tooth or a jawbone, because if it's not floating in the blood, it's not going to show up. Here's another severe oral pain patient, and it turned out that she had shingles, okay, in the tip of her tongue and also right behind her front teeth and at the papillae area. And, using right frequencies and calcium, which is antiviral, basically. Flax oil acts as a diffuser, pushing the calcium into the tissue, and some alice, which is garlic, and superoxide dismutase, SOD, and dihydrolipoic acid. We, resolved the herpes problem. Again, traditional medicine would never ever think of herpes in the tip of your tongue or on the gum up and behind your teeth, because they're always thinking, oh, shingles is on your chest or your back and it follows the nerve pathways. This is nonsense, people. A virus can appear anywhere in the body. Here's another severe facial pain patient. Boy, my heart went out to this woman. I mean, she was basically, what the doctors did to this patient made that Mengele did in Auschwitz look like kindergarten stuff. Poor Dawn, she had all kinds of nerve blocks, excuse me, in the lower left side of her mouth. She had a canine tooth, so they did nerve blocks. That failed. Back in 2006, she had root canal twice in the tooth. That failed. Then they did what they call an apicoectomy, where they surgically removed the tip of the root. That failed. Then they did an ablation of mental nerve, where they, destroyed part of the nerve. That failed. Then she did a gamma knife, which is like radiation. That failed. They did a craniotomy, where they did surgical intervention into the brain, figuring the trigeminal nerve was being impinged upon by swollen tissue or whatever. She had 32 staples in her head. I mean, that failed. It just, you can't make this stuff up. And yet people subject themselves to this Neanderthal approach to healing. Basically, the patient had a lower canine tooth, and at the end there was an infection of herpes zoster and herpes simplex 1. And I treated her with right frequencies, and in 2 weeks we got like 50% reduction in the pain. And finally, I said, do you want to get rid of the rest of the pain? I have to extract the tooth, which I did. Once I extracted the tooth, and you can see it on the right-hand side of your screen, the pain totally disappeared. It was all coming from residual viruses in the jawbone from a root canal tooth. And they did all this exotic, crazy invasive surgery and never got to first base. It's really pathetic. So again, modern dental technology is based on Neanderthal mentality. Here's a woman that had pain in the tooth for 4 years, been to all kinds of dentists, x-rays. Unfortunately, nobody considered the possibility of shingles or a virus in the tooth. And tooth number 29 there, it's the second bicuspid. When I treated her with biofrequencies of Rife, in 3 days, the pain totally resolved. So this is a serious business, and the average dentist, they have no clue about this. And the x-ray looks pristine. There's no cavities in the tooth and bite problems, but yet there's pain. So you have to start thinking virus. Here's another situation. Back in 2000, this fellow had a crown on the lower right second molar put in, and he developed back pain. He had the back pain for 8 years. And again, nobody connected the dots. And when I adjusted that little red mark on that crown, his lower back pain disappeared immediately. That was, 21 years ago, and never returned. It's ridiculous. But again, your average dentist, your doctors, of course, would never connect the dots on this, but the dentists have no idea that these things exist. Curing trigeminal neuralgia. Here's another thing. You go to the dentist, you think that these people know what the heck they're doing. And unfortunately, it's barbaric. Here, the Mayo Clinic statement regarding alternative treatments of trigeminal neuralgia said alternative treatments for trigeminal neuralgia generally haven't been as well studied as medications or surgical procedures. Yeah, because there's more money in the surgical procedures, and the pharmaceutical company has a cash cow for many, many years with the chronic pain. So there's very little evidence to support their use of alternatives. What a great logical statement that was. So drug regimes, I mean, you know, anticonvulsants they use, antispasmodics, Botox injections. This is Neanderthal. It's brutal, people. Surgical, all kinds of microvascular decompression, gamma knife, glycerol injections. I mean, you know, again, they make Auschwitz doctors look like they were kindergarten teachers, and radio frequency thermal lesioning, you know, to destroy the nerves. It's just scary. They also have a balloon compression technique. So the doctor inserts a hollow needle through your face. That in itself would flip me the heck out, and guides it into the part where your trigeminal nerve, and that goes through the base of your skull. I mean, they could screw you up for life just by if the guy sneezes during the procedure. Doctor then threads a thin, flexible tube with a balloon on the end through the needle and inflates the balloon with enough pressure to damage the trigeminal nerve and to block the pain. I mean, this is crazy, people, but this is standard medicine. Absolutely scary. So the balloon compression successfully controls the pain, but it usually comes back after a while. So, and then you can be left with transient facial numbness. Wonderful. And they still didn't get to the problem. So here's a patient that had undergone extensive fixed dental bridge work in her mouth. And the dentist didn't understand that when the bite is not right, when you restore the teeth, it torques the skull bones and jams the cranial sutures, which have living tissue in it. And this poor woman suffered for 1.5 years, and nobody could get the first base with her. So,
hi, my name is Pamela Cheedy. I was referred to Dr. Gerald Smith by Dr. Furno. I've been suffering with a trigeminal neuralgia for over 1.5 years now from a dental procedure. And I came to Dr. Smith, and he said that I had a cranial distortion, and he adjusted me. And right after the adjustment, the pain that I came in with was gone. My headache was gone, pain in my cheek was gone, and I just feel so much better. And it's been 1.5 years of hell with many different doctors who couldn't fix anything. And I'm thankful.
So the issue is they don't understand functional anatomy. And the dentists were never taught, or it's not in their vocabulary, that if you don't restore the bite on the tooth, it can torque the human skull and jam the sutures and cause chronic pain. So for 1.5 years, this poor lady, I'm sure she spent a fortune and been to many specialists and all kinds of drugs and nonsense. And here was a simple cranial adjustment to realign the cranium, and the pain never came back. I mean, you know, it just breaks your heart when these people are running around with these severe pain problems, and these doctors don't have a clue. So here's a guy who had a concussion back in 1995, and he was sitting at a college hockey game when the front row, 2 guys collided. The glass fell out of the holders. It didn't break, but it hit him on the head. So for 21 years and 9 months, this poor guy went to Mayo Clinic. He went to Johns Hopkins, University of Pennsylvania, you name it, all the top pain specialists. And they almost killed the guy with these injections of all kinds of either Botox or whatever the hell they were using. And I met him at a meeting about 4 years ago. I felt his head. I said, Andy, I can fix you. He looked at me kind of strange, like, who the hell are you? You know, I've been to the top of the top. Anyway, 4 months later, he came in. I adjusted his head one time. He walked out of pain for the first time in 21 years and 9 months. It's just brutal.
Hi, my name's Andrew Adams. I had a head injury back in December of '95, a severe concussion. It actually kept me out of work and everything for 4.5 months. I've been through the gamut of all different types of medications and procedures that doctors have tried over the years. I've been to different headache centers and different neurologists. So after a while, nothing did anything. So these headaches were 24/7 a day for the past 21.5 years. I came to see Dr. Smith a week ago, and now it's been 7 days, and I'm basically headache free. It's absolutely amazing to me for something that's gone on for so long in my life to have it gone. And I came in this morning with minor neck pain from just twisting it, and he fixed that, and now I have no headache, and that's the first time in 21 years.
So it's actually been about 3 years now, and he's like headache free, and it literally changed this guy's life. When it rained, he'd have to crawl up in bed in chronic pain, because when your head's torqued and the barometric pressure changes, the sutures get jammed even more and exacerbate the pain. Here's a woman that flew in from Tobago, 20 years, severe migraine headaches, been to all the universities, all the drugs in the physician's desk reference, and she had 2 concussions, 3 whiplash injuries. Nobody got to first base with this girl. This was back in December 15th, so like 6 years ago, or 5.5 years. So, and alcohol was a trigger to her migraine. She had some liver congestion, and we took care of that.
Hi, my name's Danielle Elephant. I live in Trinidad and Tobago, but I've been visiting with Dr. Smith now for about a month. And he did some adjustments on my cranial adjustments and put me on a nutritional plan. And the migraines and headaches that I've been suffering from for years, I haven't had experienced any since I had my cranial adjustment. And I also, alcohol, which was always a trigger for headaches, especially recently during the holidays, was thankfully headache free. So glad to experience it and share that with you. Thanks.
Yeah, it's so damn simple once you understand that if you have a toxic liver and it can't metabolize the alcohol continues to float around in the bloodstream. When it gets up into the blood vessels in the brain, it dilates them and causes a headache. Once you give the liver what it needs to detox the alcohol and other chemicals and so forth, then you reduce the level in the bloodstream and no more triggers. It's really simple, people, once you understand the mechanism. But again, these bits and pieces of information are not taught at the medical schools or dental schools. So here, rheumatoid arthritis. This woman developed rheumatoid arthritis when she was age 30. What was interesting, she had a root canal done at age 29. And if I sent this x-ray to 1,000 dentists, they would say there's absolutely nothing wrong with this tooth. But when I tested her energetically, she had a strep infection in that root canal tooth. See, it's a dead organ, and dead organs create inflammation. When you have inflammation, it acts as a magnet, drawing bacteria and viruses into that arena. And they're not going to show up on the x-ray. This poor woman was given Enbrel, which cost $13,500 a year for her prescriptions, and it also causes cancer, Enbrel. But when she asked questioned the doctor about this, well, you don't have cancer now. We're the flip answer from a medical specialist. And bottom line is, she had all kinds of problems. When we did the right frequencies, a couple treatments, she was like 98% out of pain. And so here you had a simple procedure in the tooth, and it affected the multiple joints in her body, and she was on heavy duty medication for 34 years. And nobody figured it out. So, you just have to keep flipping the rocks. So here's a woman that had pain in her right side of the neck, the shoulder, and her right knee for 15 years. And again, no one connected the dots. She had to give up playing tennis because of the pain problem. And basically, 99.99% of the dentists would look at this woman's teeth and say, "Whoa, boy, what a beautiful bite. There's no problems there." But guess what? She had 2 areas on the bicuspid teeth on the lower right side that didn't have proper contact. And all I did was bond shims or resins on the 2 teeth and have her bite down to make an indentation to give her contact. She got up out of the chair, and after 15 years of right neck, right shoulder, and right knee pain, guess what? The pain in the 3 areas totally disappeared. So it's pretty amazing when you understand the mechanisms and how the bite affects the total, posture of the body. Here's a guy who had severe migraine headaches for 25 years, and once all his mercury fillings were removed, a month later, his migraines totally disappeared. So there's many different causes of headaches. This poor woman had Lyme in her wrists and her knees, hips, right elbow. She was in severe pain. She had fatigue, no stamina. She was placed on homeopathics for Lyme and supported her adrenals. Then after several days on zymescence, which is one of the best systemic enzymes on this planet, all her joint pain disappeared. She was able to do line dancing with her husband for 4 hours with no pain. She was able to dig in her garden for over an hour, again, no pain. So you have to define what the heck's causing the problem and address it. So that's basically here. My barber had wristbands. He had carpal tunnel, whatever, and he was taking ibuprofen for his pain. I put him on zymescence, 1 capsule 3 times a day. In 6 weeks, he was 95% out of pain. So these are pretty simple cases. I think, did Dr. Nye come on yet, Jared?
He hasn't logged in yet.
He's not on?
Not yet.
Okay, well, I'll go over some more information. Just let me know when he comes on.
We have some questions if you want to answer them.
Yeah, okay, sure. Where are they? Can you use CyberScan and energy patterns for someone with a pacemaker? Yeah, absolutely. The Tesla card work with someone with a pacemaker? Yes. Basically, frequencies are not going to disrupt the pacemaker. The CyberScan should be fine. Again, like anything else, you have to define what the heck the core issue is. This is amazing. How long did it take you to destroy the herpes virus? How many treatments? It depends. Give an example. I had one woman that had 6 months of severe pain with shingles from chemotherapy and radiation with cancer. One treatment, 3 days later, she was totally out of pain. It depends on the case. The one woman, the chiropractor, she had 80% reduction in pain in one visit because we're using frequencies to literally destroy the virus. So we're not using anything toxic. We're not using anything. Oh, Stanley's calling me. Hold on. Yeah, Stanley. Hello. Yeah, Stanley. I sent you a link. You just have to click it. Oh, Jared? Oh,
I'm
Jared?
here.
Well, he said he clicked the link, but he didn't get on.
He has to enter the broadcast studio.
What's that?
Do you want to? Can you text him my phone number?
Okay, I'll text you Jared's phone number and he'll get you on. Okay? Sorry about the interruption, but little technical difficulties. Let me see. Okay, I just sent it to him. Well, hopefully he'll get on shortly. Would the Tesla card have any effect on prostate cancer? Well, again, you have to read my book, Cancer Deconstructed. Cancer is not a disease. It's an adaptation to low oxygen and toxicity. Invariably, there could be root canal problems in the patient with prostate cancer. There could be mercury trapped in the prostate. There could be fungal infections. So the 3 key factors that cause cancer: 1, low oxygen; 2, too acidic. And when it gets low, like below, you have an oral pH of 5.24, that triggers off cancer. And 3, you have low membrane potential. When the energy becomes real low, it also triggers off cancer, plus the carcinogens. So the key is you have to define what's in the tissue that's disrupting it. Is the terrain too acidic? There's very low oxygen in the area and the low energy. when you remove those, the cancer disappears, people. It's a joke what's being done out there. People are getting really battered. My cousin had stage 3 melanoma in 4 months of removing the splinters or the initiators. His cancer disappeared, and his oncologist didn't want to talk to me to learn how I got rid of the cancer. The doctors don't want to know because it's relatively simple. But the key is you have to define what the heck's causing the problem in the cancer. There's something there that's disrupting the normal physiology of the cells. But traditional medicine doesn't have the skills or the technology to define it. So you're wasting your time going conventional, just cutting it out, slash and burn, radiation, chemo. You're poisoning and damaging the body. When you remove the splinters, the body goes back to normal. So anyway, hopefully that gave you some insight to your prostate problem. Any other questions we have? Let's see. Can you explain what it means to take something like methylene blue and photoactivate it with the infrared light? Please explain what it means and the action. Well, it depends on what you're using it for. Does this mean it does not work with the light? Well, again, methylene blue will kill fungi and viruses. And in fact, I used it. I had a plantar wart in between my little toe. It took about 3 months of applying it every morning, and the wart literally just peeled off and out of went. I have a good friend who's a retired medical doctor. He uses 1 to 99% dilution, 1 part in 199 parts of water, and takes a little bit every day, and it kills any fungus in your brain. If you mix the methylene blue with hydrogen peroxide, I think 20 parts per million of the methylene blue with some not hydrogen peroxide, colloidal silver, I'm sorry, and you paint it on your toenails, it'll take maybe like 8 weeks, but it'll kill the fungus in the nails. But if you have athlete's feet or fungus in the toenails, it's a systemic problem. So if you don't get rid of the candida or the trichophyton, which is the fungus in your body, it's going to come back. So again, always think core issues. What the heck's the ultimate underlying cause of my problem? And just painting on rust may look decent for a short period of time, but you're not solving the actual problem. So do we have any other interesting questions? Doc, you going to Toronto to a conference after the pandemic slowed down? I hope so. I miss going to Toronto. It's one of my favorite cities in the world. I have really, really great friends up in Toronto, great restaurants there. But yeah, I definitely want to get back up there. But the games that they're playing, it's really, really scary. Tenderness. Bottom line is there's several different causes for tenderness. One could be if you're taking aspirin, quote, to prevent a heart attack, that'll cause tenderness. If you have an underactive thyroid, that can cause tenderness. If you have a jaw problem, there's a Pinto's ligament which attaches to the medial pole of your jaw joint into the neck of the malleus bone. That can, cause tenderness. You can have, clogged arteries so that you got problems with the circulation that can cause tenderness. So again, you have to define what the underlying issues are and address it. I had one guy who went to a rock concert and he developed tenderness, and I put him on magnesium and zinc. It took 9 months to resolve it. The nerves in the ear have the highest concentration of zinc of any tissues in the body. So there's many different components of the tenderness problem. If it's structural, you got to address the structural. If it's a physiologic where it's clogged arteries, you have to, use clinician's preference, which is omega-6, omega-3 oils in 11-to-1 ratio that basically dissolves out the plaque in your blood vessels. That could take 9 months. If there's sympathetic dominance, you have muscle spasms. Again, you have to quiet down the sympathetic nervous system. If you have an underactive thyroid, okay, what's in the thyroid preventing it from working properly? Is there tetanus vaccine from childhood? Is it glyphosate in your thyroid? Is it mercury? Is it aluminum? Is it a fungal infection? Again, you have to start looking at the core issues and stop throwing darts at the symptoms. So hopefully that'll give you some insight. I've had a couple interesting results with it. So anyway, Stanley, I'm glad you're on. And this is my Qigong master. This guy walks on water. He walks on the Lake Ontario. But okay.
Yes.
So Stanley, your information with chronic pain, I've used your technology in the clinic. I've seen what the heck you've done with patients. It's mind-blowing. And it just, and I figured out an interesting component, why the Qigong acupuncture works so well, because it changes the energy in the cells where you're having the problem. And when you change the energy in it, the cell goes back to normal. So with that introduction, go for it.
Well, yes, I'm going to talk about that in a sec, but let me talk about you. Okay, so Dr. Smith here, it's one of the person that I look up to, right?
That's because I'm older than you.
also, you know, his wisdom, right? His caring and his wisdom. That's what makes him also. And the knowledge he possesses. And all the, life that he lived, not only in healthcare, but even outside of healthcare. The life he lived is mind-blowing. Anyway, so I'm Dr. Ngui. Hello, everyone. And yes, it's the Ngui Matrix, just by touching someone on their head, okay, can initiate change throughout the body, and everything is specific, and that's the beauty about it. Okay, and you allowing energy to go exactly where you want it to go to remove pain. And you know, I know Dr. Smith and myself talk so many times about, you know, this person come in, couldn't get help, and all they did is just touch the person in a specific point. It's just knowledge you need, specific points, and the person gets well instantly. When I mean instantly, it is instant. The reason why we're looking at quantum physics here, okay? Nothing has to go through the bloodstream, and it takes like, it's time to travel down, and we wait on circulation problem, you know, circulation of blood and so forth. That takes too long. We are far past that now, okay? That's the old technology. I call it the old technology. All right, that's like the donkey cart or the horse-drawn cart era. Okay, we are now into the modern age. But the thing is, it's based on universal principles. It's based on the olden and the ancient applied Qigong, and it's also based on quantum physics. So let me take you through. Can we share a screen? Can we share the screen?
On the bottom there, it should show you, it says a share screen with a little screen with a plus on it. It should be on your computer.
Okay, here we go.
Yeah, click that.
Share screen. Okay, here we go.
And then click on your desktop what you want to share, and it should.
Okay, so that's it. Okay, so tonight we're talking about the acute and chronic pain.
Dr. Ngui, there should be one more button to confirm the share in the Chrome window.
Okay, my windows are full now. Let me escape back. I hit share audio. Share.
Was it the whole screen or part screen, Jared?
Oh, I got it now.
Okay,
Is it there?
there it goes.
Oh, there it is.
Yeah.
Okay. All right. So I didn't get the full blown up slideshow version, but that's okay. Oh, is that it now? Are you hearing me?
Yeah, we hear you.
Okay. So I didn't get rid of this sound, but it's a pleasant sound. Acute pain, as Dr. Smith was talking about earlier, it comes in all forms. Okay, and because usually when someone comes in to see you, it's because of their pain mainly. Okay, we have to decide as practitioners how to treat this. Okay, so severe acute pain requires immediate attention. And always remember that pain is an abstract and quantifiable reaction, and is analyzed by and interpreted by the brain. Okay, so the best way to approach this is actually target the brain. And acute pain, usually people work on the site. All right, but many years ago, I had an NBA player. They brought him to see me. This NBA player, there must be about 10 people worked on him prior to me. And he had an injury in his leg, and there was blisters, it was swollen, right? There's no way you can touch it. So they're asking me, can you please get rid of the pain? What I did is work on him remotely, because really you cannot work at the site anymore. That's done. And the more these people try to work on it, by the time they got to the ninth person, the ninth practitioner, that person should know that you cannot touch that site anymore. But still, these people are keeping working on the site and pretty well destroy the site. So I touch the head, and what it does, and you can literally see it, the swelling goes down. As you touch the head, you can literally watch all the swelling goes down slowly. And the body repairs itself fairly quickly. The pain disappears immediately. Okay, that's why these guys follow me around. I had the NBA players would actually follow me around. I don't go to them, they come to me. Okay, and that's how I treat all professional players. I don't watch their games or anything, but they have to come to me. But they come to me with very, very difficult problems. And yeah, so I had a good time working on these guys. Okay, so physical injury, the easiest solution is what everybody does, work on the site. But the fastest method of recovery is to work on the brain, right? To relieve the pain at the site. Why not go directly to the decision part of the body that actually decides whether it's a pain or not? Okay, so it says here, if the physical injury is not remedied on time also, the pain becomes chronic. And this means that it'll start affecting other parts of the body. For instance, the internal organs. So this is the start of systemic issues now. Okay, so now we have all kinds of pains around the body, or all kinds of damaged organs in the body. Okay, so this next slide says pains from internal organs. Okay, now it becomes chronic, and now we have to deal with it. So even if a spot like this, can you see this? A spot like this, okay? we have to look at the internal organ that is responsible for this, because the person never injured it, but the pain, he had sudden onset of this pain, okay? And the reason why I have sudden onset, that injury have to come from somewhere, and usually come from inside, not outside. Okay, outside you can see physically some batter, you fall, and something from outside injure you. But when somebody says that this pain suddenly started and is there and is increasing, you know that there is some internal organ problem. Okay, and this is a map of referred pain. So you might have a pain in an organ, for instance, the heart, and it refers to here, okay, on top, okay, and so forth and so forth, okay. Sciatic pain is probably one of the best known referred pain, 100% referred pain. Usually that's caused by a lower back imbalance. Okay, and you can instantly, if you get that point directly, you see, it's all based on knowledge. So if you can hit that point directly, the sciatic pain goes away. Simple. And I know people have sciatic pain for years. In fact, this one lady that had sciatic pain for 10 years. Okay, she came to me, and you know what she smelled like. I mean, I couldn't forget. I couldn't stay in the room, to tell you the truth, because she was only bathed once every 3 months. Okay, I just couldn't stay in the room. And what I did, I checked her out. I didn't even touch her body. All I did is touch her head, and the sciatic pain disappeared. After 10 years, and a zillion practitioners look at her. They were treating her back and her leg for the sciatic pain. And here I am, never even touched the body, just touched her head, the pain disappeared. All right, it's like, to her, I mean, they call us God, like Dr. Smith and myself. Well, we are not God, we just base our stuff on science, okay? So in physical therapies, okay, here we go. Physical therapies can only address 80% of chronic pain. If you can remedy that pain right away through physical therapy because somebody, hurt you externally, that's great. But once it becomes a little chronic, they can only remove 80%. The remaining 20% is a systemic affliction. And this is usually caused by internal organ itself or its functionality. In this case, we do have to look at the splinter, okay, the root cause or the etiology, right? They're all the same word, by the way. And secondly, we look at the pathology. And thirdly, we look at the symptomology. That's the pain that the person came in for. So we kind of go backwards to get to the root cause of it. And don't forget the exogenous factor that is critical in considering, when you're considering the splinter. Okay, something outside, probably, maybe food, maybe environment, maybe something that actually triggered it in the first place. And then it start entering your body. Okay, we have methods in checking how deep it go into your body. Like if you have a exogenous influence, like some environmental attack, okay, we can figure out if it's just entering your skin, for instance, and how deep it's actually entering into your body to figure out how severe this issue is and what it takes to repair it. So how does this work? Okay, remember I talked about swelling, local swelling. Okay, I know Dr. Smith has seen me work on people. I most of the time I do not, and I reiterate, do not touch the site of the pain. Okay, and by the time they come to me, that person comes to me, many people have worked on them before. Okay, and probably injured the area even more. So what I do is I can touch them in parts of their head, and instantly that pain would go away. And if it's a chronic pain, you do have to address the internals, whether it's an internal organ or just the function of some part of the internal organs or something. Okay, so it becomes an internal issue, it becomes a systemic issue. All right, and so we do have to address that. And how we do it, it's a lot of times I don't even look at the symptoms. The symptoms is only what brought the person in, but I work on the actual splinter itself. Okay, you have to do that in order to get rid of the pain quickly and permanently. Okay, always remember, if you go to anyone and they do not work on the splinter, okay, they're wasting your time.
Well, Stanley, you want to
Yes.
mention you have mapped out the specific areas on the skull, so it's not like you're just touching any point. You have narrowed it down anatomically, so you know what area to actually go to.
Exactly, and I'll come up to that in a few minutes.
Okay.
I have this sound, this pleasant sound that I was playing around with, so you can probably hear that. I meant to erase it, but I haven't gotten around to do that. Anyway, so the best way to actually activate this whole system is really go to the command center. Okay, go to the command center, which is the brain. Don't spend the time, with the anything down line. You need to go to the part that actually makes the decision, and that's the reason why we go directly to the brain. And Nine Matrix is a proven system. When I mean proven, it was proven over and over. I know some of the other doctors online that can actually say, and I know they cannot unmute themselves, but they will tell you the same thing like Dr. Smith and myself would say. This person had pains, right, seemingly forever. And all they did is touch them at specific points that is mentioned in our training. All right. And the system is so simple, it's unbelievably simple, and it's knowledge based. Okay. So this gives you an idea of how it works. I just pick a very simple example. If you have pain here in the elbow, for instance, is a specific point which we marked, okay, that can actually trigger the release of pain in the elbow. And these are points that you do have to learn, but it's so simple. Our system is so simple that you can learn it pretty well overnight. So how this works is based on quantum physics. The energy just rushes down to a path of least resistance, which happened to be in this case, the large intestine channel. And then it runs along the channel because of the least resistance. And then it hops off right here and get rid of the pain instantly. This happened in less than a microsecond. And that's how fast it is because it's based on quantum physics. And with quantum physics, there's no space and time. All right, so everything is instantaneous. If you want to heal someone across the world, as you raise your hand, and we've done lots of experiments like this with my Qigong class. Okay, we actually raise our hands, heal the person in, say, Australia or somewhere. Okay, and we would ask a family member. This is how we did the experiment, and we've done lots of them. Ask the family member at exactly this time we're going to send chi over or send the energy over. And although it's that far to Australia, for instance, right, or Romania, or one of those places, right, they note the time is exactly that same time. All right, the change happened. Okay, and we've done this over and over with my Qigong class. Every single advanced student in my Qigong class have experienced this. So this is how it travels, and it's all the path of least resistance. Okay, so this is like a train line. The train goes from one end of the line all the way to the next. Okay, so the train runs back and forth, and all you're doing is find the easiest way to hop on the train, and when you got to your destination, you just hop off. How simple can that be? That's so natural, isn't it? And this is the way we save the energy. Everything is saved this way, okay, because you follow in the path of least resistance. And this gives you an idea of what the Nye Matrix system looks like. I don't have the specific points mentioned here, but I have some dimensions written down. And once you learn the landscape of the brain itself, okay, it's not the scalp only, it's beyond the scalp. It goes down into the neck and so forth too, okay? So because you can access externally the brain from behind the skull. Okay, the protuberance in the visual cortex there, you can is well beyond that too. Okay, or below that. So it's not this is not a scalp treatment. Okay, and this is not a scalp therapy neither. This is Nye Matrix. Completely different. Okay, it has nothing to do with those. So I made it a little short here also because of we had some technical difficulties. Anyway, the herbs that we use is always used as supplemental treatment. The top in the list is cordyceps, then come Tianchi, then come at this time, okay, this time in the pandemic, we're talking about Fanji Hongqi Tang. All right, and I'll explain a little bit about it as we go along. Cordyceps, that does everything because first of all is an immune modulator. That means it modulates itself or it reforms itself, right, to whatever attack comes its way. So in our classes, we talk about if you have what do you call it? Something went wrong in this area, this area, this area, this area. Okay, so you have external influences or internal influences that affect you. And it doesn't matter if it's a positive, which we call yang, or a negative, right? It'll always haul you back to center. Okay, and that's the reason why you don't have to know much about the herb in order to use it, because it doesn't matter what happens, it'll correct you. Okay. Also, it has a biomarker called cordycepin. What this does is inspects your DNA strands, and if you look at the extension of the strand, which we call the ribose, that's housed what you call it, the oxygen molecule. So it looks for it. If it doesn't see it, it it decides whether or not to destroy it or not. So it's really a part of apoptosis also. Also, it has a long chain polysaccharides, and what that does is it's like a smart bomb. It scans your body and find out where unwanted masses are, and it seeks it out and destroy it. Okay, so for those two reasons, it's actually pretty good for cancer too. All right, and many other chronic diseases, by the way. For cancer also, because it makes the lungs more efficient. Okay, allows more oxygen to get into the bloodstream. And not only that, it actually makes each cell wall more permeable. So it creates proper irrigation. So it allows oxygen to go into the cells. It allows more nutrition to go into the cell and allow the waste product to leave. Right? And that's what you need for a lot of the chronic diseases, including cancer. All right. Also, it has all the amino acids, vitamins, and minerals to sustain life. So what else do you need, right? It has everything.
Stan, you forgot to tell them that you put your chi into the supplements, which is Sunoco racing fuel. Come on.
Well, what happens is they've done experiments where they've taken a product, okay? And they have another company selling it, and I sold it. And they found out, they took it to a lab and actually analyzed it, and they found that our stuff was far superior, like is the best you can find on the market. And so the question is, if we have the product that comes from the same place, why is mine so different? I didn't want to talk about that because it sounds like I'm, but well, thanks for bringing it up anyway. Yeah. So that's one of our little secret anyway. So also it's good for the kidneys. Okay, cordyceps is really good for the kidneys, and it kidneys, lungs, and the brain. It increases the neurotransmitters in the brain, in the quantity and the quality. Okay, so it just gets you smarter, and you'll find that if you run a lot, like if you do long distance running, the stitches or the pain you have on the side of your abdomen here, none of that would ever happen to you again if you take enough cordyceps. Okay, because it makes your whole body more efficient, including moving oxygen and all the nutrients and so forth. And that's a good test to see how good the cordyceps is also. All right, so we covered that. It has adenosine triphosphate, which is raw energy for the cells. So, I mean, you have it all there. Okay. Tianchi, on the other hand, it's actually, these are single herbs, and single herbs is like a single malt. They're the supreme. Okay. Tianchi, long ago in the ancient days, what they used to do with Tianchi is the soldiers would take the Chinese soldiers actually would take some powder and put it in their pocket. And if they should get injured and bleeding, they would take the powder and throw it on the cut or injury, and also take it, consume it at the same time. And it will stop the bleeding and they can continue fighting again. All right. So Tai is good for, first of all, the liver, heart, and brain. Okay. When people have any kind of brain dysfunction or mental issues, Tai is one of the best things to give to them because it helps to move. This one helps to move chi rather than blood. Okay. People believe it moves blood, but wherever the chi goes, wherever the energy goes, the blood would follow. Okay. So it seemingly moves blood, but really it moves energy and the blood follows. So it improves circulation. So when you have injury, any kind of injury, whether it's internal from an internal organ like cancer or anything else, it doesn't matter what it is, or somebody hitting the leg, right? It creates what we call stagnation. That's why it becomes black and blue eventually and so forth. Yeah, everything stagnates in the area. Tai removes that stagnation. And this is the reason why it's really good for pain also. Not only cordyceps, but Tai is good for pain because it removes the stagnation, and it creates movement of blood in the area, and it helps to repair faster. Okay. Yeah. So Tai is really known as a herb to circulate chi. See this last word here, chi, helps to circulate chi. And we use it for everything because you want, in fact, if you take this on a daily basis, like cordyceps is really good for you because it helps circulation, it helps things to move in your brain, everything to move in your body more efficiently. Okay. Fanji Hang Chi Tang now. This is a combination herb. And like any combination herb, you don't take it all the time. So you have to take it when it's appropriate to take it. And throughout this pandemic, believe me, it's appropriate to take it. This is one of the leading herbs that Chinese use, okay, to ward off the COVID and also any of the variant, because it's based its principle on viral attack, not specific to COVID itself, but it's so good that it'll actually address COVID also. Okay. What it does is actually, first of all, strengthen the lungs. Secondly, it actually regulates fluid metabolism in your body. So it doesn't allow swellings or fluid to build up, inflammation to happen. Okay. And those are the two main things, right? You want to get rid of inflammation so that you pretty well don't drown yourself if you have a severe reaction to any of the virus or any of the vaccine that they have out there. Okay. What cordyceps does, I'm going to come back to cordyceps for a sec, in terms of viral attacks too. You know, the virus, it's like a ball, okay? And then you have the spikes, and they have the bulbous end, the round end, the bulbous end, okay? What cordycepin does, that's the biomarker within cordyceps, it actually blunts that bulbous end, so it doesn't stick to the wall of interior wall of your lungs, so it doesn't infect you. So these viruses can be in your lung, but they cannot adhere themselves to the walls of the lung. So you can be walking around and someone cough in your face. It really doesn't matter. Okay, you still have to be careful, of course, but it really doesn't matter because the virus cannot adhere to you. Okay, so these are the 3 herbs I'd like to bring up. There's another one, like so many things we can talk about. Anyway,
Stanley,
there's
we
things
can
can talk about.
continue it next week if you'd like, because I didn't get a chance to talk about the supplements for pain, and also if you want, we can continue it next week.
Of course, we can also do that. There's so many topics, Dr. Smith, I want to talk about. It's unbelievable, unbelievable. I want to talk about the mind. I want to talk about, something. Mental issue is a big thing, especially now with a lot of people, are suicidal now and so forth, and going to very deep depression because of this pandemic. And the government is really trying to help them out a lot to be depressed because they're having different shutdowns, right? They're having closures, and then they release you, and then they have closures again, release. That's very frustrating and very depressive, actually.
Yeah.
So going through that, that could be also a good topic to talk about because of the times we're in right now.
Well, Stanley, before I forget, give your website where people can order the herbs.
Mm-hmm. No, I want to talk about one before we do that. I
Okay.
hope I don't forget to give you the website. But my website is very simple. My last name, Ngui, style, Style. If you just type in that alone, it'll take you to our website. Nice style. That's all you have to remember. Okay, let's talk about WOM now. Okay, the World Organization of Natural Medicine. It's a worldwide organization in 23 different countries. That means we can pretty well go, Dr. Smith and I, of course, because we are senior professors, okay? We can actually go into any of those universities, okay? And be a part of them if you would like to. Yeah, so this is worldwide. A lot of people, because we don't speak much about it, don't realize the scope of it. Okay. Also, the Board of Integrative Medicine is a board that is a kind of affiliated, but is a regulatory board. Okay, this is a regulatory board, and WOM really doesn't have any jurisdiction over this board at all. All right, it's independent, and they make their own judgment as to the qualifications of the practitioners and so forth. Okay, and I just have my stuff here, nice style, and this is all you have to type in, Ngui, Style, and it'll take you to our website. Another website that we have is New Me Naturals, that has like things like cordyceps, all the saleable products. Okay. Now, the World Organization of Natural Medicine, the University of Humanitarian Medicine. Okay. We are really now doing the health coach program. And really, it's a career opportunity and a clear career path. It's absolutely clear. So you know exactly what you're doing. Okay. It's clearly defined for you. It's a prestigious career. Okay. Why? Because it has to do with healthcare. People respect healthcare practitioners. It's knowledge driven. Okay, so you have to have some knowledge. Good earning power. I spoke to Dr. Sheila the other day. They said you can start at $150 an hour, just to give you an idea. where your starting point can be. Okay, whether you do it full time or part time, it doesn't matter. Really doesn't matter. If you make $150, if you just want $300 by today, all you have to do is, what 2 sessions only. The beauty about it, it requires no equipment, absolutely none. The only equipment you need is a computer or a cell phone for communication if you want to work remotely. And the reason why I mention this is because we are in this pandemic phase now, and most of us work, remotely. So you probably need a cell phone and a computer. That's all. Otherwise, if you see someone face to face, you actually need nothing other than a room, a space. You gain respect from your people. And that's the beauty. You can be like a little leader if you don't want to grow that big, a little leader within a community. And that's what we are also looking for, people who wants to have a leadership role within the community. There are 12 subjects, and you can choose your subjects within the 12, right now within the 12 senior professors. Okay, there's only 12 senior professors now on board. Okay, and you can share, you can decide what subjects you want to do. Remember, you only need 10 credits. Now you have 12 senior, so yeah, you can choose your subjects. The beauty about it also is international certification. Okay, it's not for Ontario only, it's not for Canada only. It's actually international once you get your diploma. Okay, so with your diploma, you can immediately start your career as a health coach, like absolutely immediately. All right, you'll be trained enough to be able to do that. So don't worry about your training, right? You know that it's easy to just become a health coach, and we have so many professors, we can help you at any time. And thanks a lot from Dr. Smith and Dr. Nye. And any questions at all about this? Dr. Smith, are you there?
Yeah, I'm here.
Yeah. I hope I said enough, or if you'd like to add something about WOM, you could.
Well, someone had a question about the COVID vaccine. My philosophy is it's the best thing on this planet as long as it stays in the bottle.
Well,
yeah.
With the vaccine, okay, I mean, if somebody is thinking of taking it, okay, you do have to prepare before, because you don't know the likelihood of what's going to happen afterwards. You know, it was fatal to quite a few people. Okay, so you don't want to be in that category.
And also you want to make sure your insurance is paid up.
Yes, yes. But there's preparation, like if you have weak immune system, for one, you do have to be careful. If you have, in Chinese, what we call a yang state, that means overreactive state, right? I would, you have to prepare yourself before. These are a preparation you can do before and after, actually. If you have weak lungs of any kind, that means whether you have, what do you call it again?
Emphysema?
Anything at all.
Yeah.
Any kind of lung disease, okay? You really have to be careful, especially reactive lung disease, okay? Yeah, so you have to prepare. What I do, I give people various herbs. If I cannot see them, you can use a cyber scan if they're too far away, and embed the frequency in a card, for instance, and give it to them. There's so many ways to do it. So you need that protection, okay? If you don't get that protection, you can be, in that percentage where it's very fatal to you. Okay. Yeah. So what I do is tell people you have to be okay, and I kind of check you and make sure that you're okay before you actually do the vaccine. And you should continue the regime 2 weeks after to make sure that you're clear and you don't have any adverse reaction. Okay. Yeah,
The bottom line, Stanley, if you just build your immune system up, you don't need the vaccine.
well, that's why we don't need the vaccine. You know why? Because I use the herb that prevents COVID, and secondly, I use cordyceps, and you all know that.
Yeah.
So I go into my clinic. I can go anywhere. I go into the stores, and so if it wasn't a law to put your mask on, I wouldn't put my mask on.
Right.
Okay, because I feel confident. Okay. You still have to be a little cautious, of course. If someone coughs, you have to. What I do is actually stop breathing, hold my breath for a while. Okay, because you can test that, see how the look at the wind and see which direction the wind goes. If someone smokes tobacco, okay, you can smell it downwind, probably for maybe 100 yards quite easily. And so that air is actually going all that way downwind. All right, so the COVID could be traveling with that smell too, okay, because the person is exhaling. All right, if someone is smoking and you smell their cigarettes secondhand smoke, just as well as you smell the secondhand smoke, just as well that COVID can actually get at you. Okay, so you need prevention. You must need prevention of some kind. You have to be proactive. And that's all I tell people.
So basically they can buy these herbs on your website, right?
They can get it on the website. And if you don't find it on the website, just phone us or email us. And once you get on the website, you can email us quite easily anyway. And you yourself, we can always send out cards. I mean, you can send out cards to Dr. Smith.
Someone asked about the health coach program. Where can they learn about it?
They can learn from Dr. Smith.
Okay.
Or Dr. Nye. Okay. You can go to WONM. Okay. WONM. WOM, the World Organization of Natural Medicine. Just type that in and it'll take you to the websites. And then you can learn about the World Organization of Natural Medicine and all its affiliate organization, okay, including the humanitarian sector. And if you have any questions, ask Dr. Smith. I think the topic is, the header for your talk here is to ask Dr. Smith. So yes, ask him. And he's going to tell you, you can enroll in his program, you can enroll in my program, you can enroll in many of the other senior professors' program too. But you need 10 credits in order to get a diploma and in order to practice. And, that's the only way. If you registered and have a diploma as a health coach, okay, it gives you access to get malpractice insurance. And so you cannot go out and say, hey, I want malpractice insurance. Okay. No insurance can sell you that, not unless you belong to a regulatory college. Okay. So that's a way to do it.
Great.
So you'll be fully armed once you finish our course.
Good. So next week we'll have it the same time, and now that you know how to get onto the program, we'll get you on Hoyer, and we'll cover some more information regarding the herbs and the 9 matrix concept and other supplements. So we can deal with depression and a lot of potpourri topics.
Mm-hmm. Okay, sounds good.
Yeah, thank you so much for taking
Thanks.
time out of your busy schedule.
Yeah, let me. I forget to get out of this sharing mode, but it's okay. We're
Yeah,
anyway. What I like to do at the end of every talk is to end slideshow. Okay, what I like to do in every talk is have the audience cannot unmute because we're on Facebook. Where are we on? Are we on Facebook? Facebook Live?
I think we're open to YouTube that they're
Or
putting.
YouTube?
Yeah, and I think Facebook.
So
Yeah,
anyway, good night, everyone.
absolutely. Thank you for
Good
taking
night.
time out to join us.
See you next week, same time, same place.
Yeah, next week, same time, same place. The duo, the health duo.
Yeah.
Okay,
Okay.
great. Thank you so much.
Thanks.
See you
Good
next.
night.
Right. Good night.